Assalamu alaikum. For this session, we will continue with the health education. We reach up to the history of health education and information department in Ministry of Health. So, in Ministry of Health, the health education department, it started in 1975. So, as a separate department for health education. It starts first with 7 staff, then those 7 staff in 1990, they increased from 7 to 10 staff. So only there were 10 staff up to 1990 who are holding the health education and responsible for health education in the Sultanate here. Then number of health educators, this is might be in 1912, so they reach up to 156, and they are increasing year by year. So the strategic plan, there is collaboration with the health department. So collaboration between the health education department and other departments. Also the government and other private sector. So health education, it cannot stand by a separate people or a separate department only. It has to be a cooperative effort between those who are working in health education and other sectors. Other sector in the Ministry of Health and also in other ministries. They are also having cooperation with them in order to plan the health education material which is needed for each specific group. So from the strategic plan also, they deliver health education to public and raise the community awareness. So this is from the purpose of the health education, that they have to raise the awareness of the community and plan and implement health education activities. Also, they are sharing and preparing for exhibition for health education, preparing for conference and also leading conference, workshop, provide technical support for production of health education material. So, in order to prepare a health education material, you have to need some either financial and equipment in order to plan and in order to implement the health education programs that's planned. So the organization structure of the Department of Health Education in the Ministry of Health, the Health Education Information Department, there is administration. Dr. Halima Al-Hanani was the administrative for the health education. Then they have a coordinator at the Ministry of Health. Then we have two sections. We have the program section and the legend section. So that health education and the Ministry of Health, it has 2 sections, and they are working in collaboration with each other. The objective for health education department in Ministry of Health here, to raise the public awareness in coordination with health department and sectors. Also, so there is coordination and cooperation between the health department and health sectors within the Sultanate. So they are the liaison for that and for the cooperation. Plan preventive measures. So it come on their hand to prepare a plan to prevent of a preventive health measure, strategies in order to fight health problems when any health problems are arising. So when any health problems are arising, they have also, before arising, they have to prepare for it. They have to prepare a health education for it. But when it arises, it means that the concentration will be more. And if you saw in those previous 3 years, when coronavirus started to spread all over the world, the concentration at that time, it was on preparation of material to increase the awareness of the people about the preventive measures that can be used in order to prevent the corona or the being affected by coronavirus, in order to avoid that disease. And even though they should not ignore other health problems that it might arise. Ensure the provision of optimal health for individual. So from also their work or objective, they have to ensure that the optimal health for all individual. Educate and encourage individual to communicate about taking care of their health and their lifestyle, because some of the diseases are coming from the change in lifestyle. So they are concentrating also on lifestyle. Eliminate health risk factor to foster the positive practice among individuals. So also they want to raise the health awareness in order to maintain the health. In order to prevent the disease, we have to raise the awareness of the people. We have to raise the awareness of the people to go toward also the healthy life and healthy lifestyle in order to avoid the disease. Section and department of the health education, we said that there are 2 sections. What are they? What are the 2 sections? Program section and diligence section. So diligence section, the aim of it is to increase the health awareness among the public. It is specialized in production of health education material. So they are producing health education material. Either the health education material that we are seeing at the hospital, which is coming as a pamphlet, or health education material which come as videos or awareness videos that we use, we see it in the mass media. So all of those programs are prepared, or all of those material are prepared by this section. So there are specialized people who are planning and implement their plan by the end product of that film or that pamphlet for health education in a specific disease, for a specific disease or specific. Coordinate with a different health sectors. So also they have to get the cooperation with other health sectors in order to apply the health education for the people and to be sure that the health education is reaching others. Also, they are liaison with different media resources available. So when they are preparing video, how it will reach the people? it has to be there arrangement. There should be an arrangement with the mass media people. So they are a liaison. حلقة وصل يعني between the mass media people and the those who are preparing the programs in order to implement it and in order to broadcast that program to the people. About section in the department, the program sections, as we said, it plan and follow up and evaluate the health education activities at the Ministry of Health. So planning is there. After planning also, they will implement and evaluate the effect of it. Does it give the effect or not? If it doesn't give the effect in this case, they have to see what's the problem within. Is it within the program that they are doing? Is it within the material? So they have to change their plan. Or is it implemented on a people, not on the target group? Follow up the health education activities in all governorate. The programs, the campaigns, and also the exhibition in each region during national and international occasion. So, and if you see that some, they have also a day, special day for each disease sometimes. So in that special day, they are also concentrating on the health education, or in that special week, they are concentrating on the education for that disease and the awareness of people. And they have to follow up that. Develop health education skills for the worker. So also they have from their objective of the program that they have to develop the educational skills of the people. How they will develop the educational skills? Through what? How can I enhance your ability to be a health educator? Are you with me? So how we can enhance your ability to do health education? Improving health communication skills through what?
Literature.
Through training. So there should be a training for the people. Training, it can be as a workshop, it can be as a conference. So they are preparing some workshop, some conference for those who are going to be a health educator. For the health worker, in order to enhance their ability in health education. So cooperate with governmental and private sector also to set a health plan and project. Yes, they are a department from Ministry of Health, but their responsibility it is not only for the Ministry of Health institution. So, because their objective it is for the whole country. So they are also cooperate with other health sectors and other sectors also in preparation for that. Follow programs of for health indicators of strategic plan. You know, each 10 years there are strategic plan and they are preparing for the coming 10 years. Depending upon also their statistics in the previous 10 years and evaluation of the previous plan. So according to that, they are improving and trying to prepare their material in order to be going with that strategic plan. About responsibility of health education and information department also, they are producing the information and educational and communication material, follow up and evaluate health education activities in all region and the Sultanate. They are broadcasting health education program in mass media. They are doing training of health educators, activate world, international, and regional and national days. So they are activating those by doing activities during those days and occasion related to that issues. And I think last week or this week you shared with one of those activities. Yeah. So you were a member who share with some of the activities, which is raising the awareness of the community. Organize different health exhibitions. And your work, what was your work? What was your share during that event? Huh? What was your share? So it was about mental health. The target group that were there during that exhibition. So it was for students. So there are many activities which is done either if it is done by the student, if it is done by the health worker, so they are completing each other. Highlight of department activities in 2012. In 2012, the department organized and participated in 5 exhibitions. So there were 5 exhibitions during that year. Department participated in also conference abroad of health ministries of the Gulf Cooperative Council conference. So it was for the Gulf region. In the 37 session, so it was the 37th session for that. Intelligent care and sustainable health, also future vision conference for health system for that year 2050. So they will share also in the future vision conference for 2015. Also, 21 health education material were produced in the health topic, in many health topic and health subjects, and messages were broadcasted in different TV and radio programs. Also, those programs sometimes it might be local health education programs, or sometimes also some of the program it is cooperation between the Gulf region, and they are preparing it together. Sometimes also there is some help from the World Health, even from the World Health Organization. In all the countries for health education sector, they are getting some cooperation from the World Health Organization for preparing some of the material. Achievement related to the indicators of the 85 years health plan, producing of educational material in field of chronic kidney diseases. So they produce some material related to kidney disease. And healthy lifestyle has developed training program for health education, They organize 2 workshops during that year for health education, participate in meeting, conference, workshop, and international 3 staff. They were sent internationally to participate on that. So the main activities of achievement by health education department, also not from the syllabus, the service, which is raising the public awareness, as we said, this is the main function. Producing health education material, this is the main. Building capacities of health worker, training of health worker, planning and monitoring and evaluating health education activities, to provide technical support for health program development in the community plan. So this is the main function of it. Ongoing project, educational material exhibition, as we said. So annual plan for educational material, step followed by the department in order to produce health education material. Future projects also producing of mobile application. So they are planning to produce a mobile application for health education. And also international health educational material production to be prepared. So you can refer also to, in order to see the activities of the health education department, to the site of Ministry of Health. So this is the site of the Ministry of Health website, and you can see also information. And there is also the e-library which is available, and I think all of you are a member from and using the e-library there. The office of the health education, it is in Khawla Hospital in Al Watiyah. So this is about the health education. Now we will continue with the other session with the so there are 2 sessions, so we have to continue the 2 sessions. From next week, you know that it is only